afternoon. My name is Erin Weaver, and I'm the Program Manager for the Hospital Medical Home Demonstration. We all want comprehensive, thorough health care with attentive, trained doctors, with the ultimate goal of feeling good and being healthy. Yesterday, all my troubles seemed so far away. Have you ever experienced the challenge of trying to get in to see your doctor versus an on-call unfamiliar with your history? Ever had a challenge trying to get in to see a specialist? Or been discharged from the hospital with unanswered questions and lack of support? And did you know we forget 50 to 80% of what we hear in the doctor's office? Help, I need somebody, help, not just anybody. Well, look no further. The Hospital Medical Home Demonstration is here to support those challenges. A training ground for doctors to practice in a new healthcare environment and work together. This 2-year, $250 million project funded by CMS provides financial incentives to support hospital teaching programs designed to improve the quality, continuity, and coordination of care that New Yorkers receive. This project helps restructure practices into patient-centered medical homes, practices that make it easier for patients to keep their appointments, communicate with their doctors, and have their health issues and preventive services carefully monitored. A massive project only made possible by collaborating with some incredible partners. Ooh, I get by with a little help from my friends. Ooh, I'm gonna try with a little help from my friends. Well, who are those friends? Partners in DOH and organizations throughout the state. But most of the critical work is being done by 61 hospitals, more than half of all teaching hospitals in New York State. This program is changing the way 1 in 3 doctors are being trained. 5,000 residents, family medicine, internal medicine, med-peds, pediatrics. Not that there wasn't enough for them to learn to begin with. I think of 8 days a week, forcing doctors to think about who is my patient, where have they been, and where are they going? A total paradigm shift, forcing us to realize that most of healthcare doesn't happen in the doctor's office. It happens with the patient. How does this program work? Hospitals chose residency training programs and outpatient sites to participate in care coordination programs and inpatient quality and safety improvement projects, ultimately changing the way 1 million New Yorkers are receiving care. Data is reported on the various program milestones to our incredible data experts in DOH, who analyze a total of 1,100 different quality measures in order to track healthcare improvements. With Obamacare, we have 1 million additional New Yorkers receiving care, improving their access to care. But will that mean those individuals are actually receiving better care? It's so critical that the health care they receive be focused on improved coordination and prevention. She's in love with me and I feel fine. Well, you may feel fine, but this program is focused on preventive care, training on population health and prevention, better chronic disease management, patient engagement and education. Hospitals have had to learn to report on a variety of different clinical performance measures. Diabetes care, controlling high blood pressure, screening for cancer, and for children, counseling for nutrition, lead screening, and immunizations. And in collaboration with the Office of Mental Health and the University of Washington, 19 of our hospitals chose to work on integrating physical and behavioral health care. And 1 year into the project, 96% of outpatient sites have shown improvement in depression screening. Hospitals must also develop an infrastructure to ensure information between settings of care. And by requiring medication reconciliation, we found that people can avoid being readmitted to the hospital. This project also requires hospitals to report on 2 of 6 inpatient quality and safety improvement projects and move up their performance at least 1 performance tertile by the end of the project. I want to hold your hand. A critical issue we see and hear about is the silos. Hospital departments, residency programs, physician practices, and community clinics need to communicate with each other a lot more. The ultimate goal of this project is improved coordination and access, better communication, patient involvement and education, and training of all new primary care doctors in New York State in this new paradigm of healthcare, patient-centered care. This project has helped hospitals prepare for DSRIP, where quality improvement and payment for performance is the wave of the future. Thank you to all of our partners, our hospitals, and to our hospital medical home team. Come together right now over me.